Today is turning out to be just as wonderful and enlightening as yesterday was. And as Her Excellency was just saying, AI is detecting diseases before humans, and we need to capitalize on this. And this is what this conversation is really about. We're going to explore the critical role of proactive interventions in improving health and in reducing disease. We'll discuss the latest advancements in early detection, diagnosis, and prevention strategies. And I will start by asking you, Mr. Alireza, how can healthcare providers provide better service and better engage with patients to promote preventative care?
Thank you for the question. I think as a provider, the best way to help prevention is education. And as a provider, there's many tools and many channels to educate patients. We start from the facility itself. Most of us as large providers have millions of medical records and a huge database. It's important to have an up-to-date digital and IT system to be able to segregate the information according to your need by age, gender, disease, etc. Once you have that, assisted with AI technology, you can target your messaging to such patients in the different media and throughout your portals and so forth. The second way is basically throughout the open media, the different types of media and within your website and so forth, to basically tailor and have simple messages. AI can also be used there to target your targeted audience for that. The traditional methods of education are still valid. In our case, we have open lectures to the community. We go out to the community and give lectures. We go out to malls. We go to schools. We give free examinations and education. And I'm always surprised about the number of people who actually come and join these open forums. And of course, these people, once they get educated, they spread the message to their families and friends, which is the way to spread such messages. Obviously, all these efforts are great CSR, but they actually make good business sense for the organization, because it puts you as a leader in the community, especially in your specialized healthcare, and you're looked at as a trusted, so it really has a good payback from a business point of view. Telemedicine is something that's starting, but I see that growing over time, and I think it's basically our responsibility as governments and as providers to provide infrastructure, especially in the rural areas, to be able to utilize such technology in the future. I'd like to share also an experience that we do in Egypt. We have a network in Egypt, and there we have a low-pay hospital, and we, along with charity organizations and our own sister charity organization and the private sector, we are always sending caravans to the rural areas where we give screening and educate people and come back and give free surgery or provide low-pay surgery for people who cannot afford.
Wonderful initiative, and the combination of good CSR and making good business sense, you can't beat that, really. It's actually a combination of patients being educated, AI being utilized, and good old-fashioned community engagement. Right. Mr. Ventricelli, what do you see as the next big opportunity for AI in healthcare?
Good morning, ladies and gentlemen. Honored to be part of this panel. So when coming to the biggest opportunity, AI is already very pervasive in the solution and proposition that we bring to the market already now, and helping a lot in creating more productivity has been a lot of efficiency. Maybe one example for all, we can halven the scan time of very important procedure. You can imagine a procedure that would require 40 minutes that can take 20 minutes or less than 20 minutes. This creates huge productivity and efficiency. And this is, of course, already happening right now. But the next big frontier where really AI can bring huge impact is in what we call predictive healthcare. So really getting to real prevention that we predict. And this predictive healthcare can be seen at individual patient level and then also at population health. A couple of examples. If you think about patient and individual level. So recent breakthrough in AI in AI applications suggest that we can predict an heart attack up to 10 years before it happens. Yeah? That sounds amazing. And through deep machine learning, we will be potentially allowed to predict the risk of lung cancer for 1 to 6 years. This sounds already amazing, but if you think of using AI tools, analyzing communities, population, then you can really, and the risk factor related to potential disease of these communities, you can really enable the preparation of preventive measure with a huge impact. And I think this is really the next frontier, population health. And maybe let me conclude with a bit of a teaser. Here in the Emirates of Abu Dhabi, through a collaboration with the Department of Health and Malafi, we have developed together a image exchange platform, already fully operational, at fingertip of all the doctors in the Emirate. They can have access to the image. It's already futuristic in itself. But now that the platform is ready, then this could be enhanced with AI. More to come.
More to come, okay. And just very quickly, regarding anticipating heart attacks 10 years in advance and lung cancer 1 to 6 years in advance, what is the timeline for this? When could we see this actually happening?
Look, the timeline, I think, is not really clear because will be defined by how we address some of the challenges that we still have. From one side, maybe we will get back to that maybe later, from data availability and also intentional investment in these type of tools. But so it's up to us to decide how fast we can make it happen.
I think it's about accessing data, but we will get to that shortly.
Yeah.
Mr. Haldar, how are you leveraging technology to improve early detection and diagnosis?
Thank you, Ramia, for that great question. Thank you for having me here, and salam alaikum, everyone. So I'll just break down the two parts of your question, technology and early detection, and I'll sort of try to summarize how we are joining the dots between the two. We are from the lab industry, and lab, by definition, we are in the early part of healthcare continuum. If you talk about healthcare from preventive care to quaternary care, we come at the early part. So by definition, we are about early detection. What we do in our lab sort of influence 70% of doctors' decision on what medication, what treatment to take. Conventionally, biomarkers were the way to go. It still is a large part of our business. What we are now doing with technology is going more upstream. So there are far more advanced markers available for critical diseases like cancer, diabetes, cardiovascular diseases. There are now even FDA-approved tests like circulating tumor cells, CTCs, where doctors can actually see the progress of cancers, certain types of cancers. There are, of course, technologies that we're using like next-gen sequencing. So whether in our genetic center that we opened up a couple of months back in Sheikh Tahnoon Medical City, we are now doing non-invasive premarital NIPT test, which earlier we were sending outside the country. There, you can sort of detect certain deficiencies in a fetus as early as 10th week of pregnancy. So we also run the Federal Lab of Newborn Screening, where a wide variety of hereditary diseases can be detected, where a newborn can be treated within 5 to 7 days of birth. And there again, we use quite a bit of cutting-edge technologies, our experts will know whether it's automated immunofluorescence, tandem mass spectrometry, to name a few. We also have, and very proud to run 5 of the largest anatomical pathology centers across the country, whether the Sheikh Khalifa Hospital, Specialty Hospital in Ras Al Khaimah, or Al Qasmi Hospital in Sharjah, Sheikh Shahbood Medical City, Tawam, SSMC. We are actually introducing digital pathology, where we will be connecting all our AP centers. And this is where the role of AI comes in even more. So it's not just about scanning softwares, which fast tracks. It's about the layer of AI which sits on top of it, which can annotate the whole slide images a lot more faster, enabling our doctors. So one can go on and on about technology, and most of it, what I have said, is what happens inside the lab. Actually, what I'm quite passionate about, what's now happening, where we are actually getting patient in the center, because at the end of the day, we are about patient care. And in the lab, while there have been a huge amount of technology change over the past decade, the look and feel of our report has pretty much remained the same. So it still looks the same as it used to maybe 8 or 10 years back. And so-called quote-unquote dumb report, if I may say so, we are thinking how to make it a smart report, how to have AI-enabled reports, which makes it easier for a patient to comprehend what is written on that report rather than Googling it always. So that's where I feel a convenience revolution is out there, where patient will be a lot more empowered. Thank you.
And I think all patients take those lab reports and start to Google the results and get a lot of convoluted answers. So definitely we need more palatable reports for patients. And all of this innovative technology is useless without accessibility. Mr. Alireza, how can we ensure that these technologies are accessible to all?
I'd like to answer this question by a project that we're about to embark. We're mainly an ophthalmology network, and in ophthalmology, diabetes, it's one of the main causes for ophthalmology diseases. We've been looking at different diabetic retinopathy AI-assisted screening systems for the last couple of years, and we've tried a few, and now we have basically settled on one that is 90% accurate. And we're about to launch mass diabetic retinopathy screening programs in coordination with the government and a pharmaceutical company, hopefully very soon. And we're also talking to the insurance companies to cover some of that cost, because this will pay back to the insurance by reducing the amount of the diseases that can come as a result. So with this program, basically, we might start with free, open screening and allow anybody coming through our network to basically get a free screening. And this will hopefully detect any potential diabetic retinopathy. Usually right now, the patient will come to the clinic when they have symptoms. This will give them a heads up, and this can be prevented. In the long term, this will reduce a lot of the potential diseases, hopefully. In the future, if this succeeds, we can spread this system across optical shops, pharmacies, and this can be basically a countrywide campaign that can really have an impact to the community.
Wonderful CSR, but these patients are asymptomatic, so why would they be encouraged to visit your facility?
No, well, I mean, it would be for free. If we put it in the right locations, as you're coming to do your teeth, you can just go and you have nothing to lose and take that test and see what you get. So over time, we'll be spreading it through different patient touch points, and you can just have something that you can basically do preventive health care. And as an educated person, you hopefully will take advantage of that.
Fantastic. Mr. Ventricelli, you touched on this earlier, but if you would just elaborate on the barriers preventing us from fully realizing AI's potential in the sector.
So I think was already explained very well during the opening session by Her Excellencies. There are a number of challenges, starting from a talent challenge, talent deficiency still, and also a leadership change management challenge. And the third big one is about data. And maybe let me go a bit deeper into so AI is as good as the data it relies on. So integrity, quality, availability of data, and flow of data, to have the data where they are required, is very important. According to a survey that we run every year from the last 9 years in the most important geography, Future Health Index, the healthcare professionals, 76% of the healthcare professionals, tell us that this is the key challenge, especially even more when looking at underserved communities. Yeah? So, but I remain in that context positive, and what we can do in order to allow this integrity, quality of data. First of all, it comes through collaboration and really integration to address the need of creating standards. Standards were about the quality, about the security of the data, about the privacy, and about the ethics like came out. And the other is about liberating the data, so breaking the silos, and therefore creating kind of an open ecosystem approach. Maybe an example, before I gave an example of what's happening here in the Emirates of Abu Dhabi. We faced this challenge in working in an ecosystem in the Kingdom of Saudi Arabia recently, with Sadaya, the authority of the artificial intelligence, for a project related to developing AI algorithm for early detection of breast cancer. A very terrible disease with the opportunity to be prevented, and with the right tools. So we had to navigate together with MOH and other authority to understand who provides the data, the relevant data of the Saudi population, to develop algorithm that can be much more impactful. As human beings, we are very similar, but we also have our specificity. This was the part that took more time. Once that we agreed about this, about the IP, then the project was flawless, and the algorithm has been developed, and the project has been fully completed. And now we're working on different one.
So accessing data is the biggest challenge because it is not freely available, essentially.
Yeah.
Mr. Haldar, very quickly, I think we are running out of time. If you could tell us how we can improve the accuracy and efficiency of diagnostic testing, in your opinion.
Sure. So yes, we are talking accuracy and efficiency, related but parallel tracks. I'll remain brief over here. What we do day in, day out, from very mundane, regular routine things to a very complicated processes, everything that we do in lab is about ensuring that accuracy. So whether it is running controls and calibrators beginning of every shift, twice a day, every day of the year, whether it's doing proficiency testing, whether it's having KPIs for every steps of the process, having accreditations of all kinds where you have external pairs of eyes coming in, like all our labs are ISO accredited. The bigger ones are CAP accredited as well. So we do all of these to ensure that the reports are accurate. So just to give you an idea of some of the KPIs, there is a KPI in the lab of percentage of corrected lab reports. Across our network, it's about 0.4%. Versus the international standard of less than equal to 3.3%, say, for example. That sort of proves that how strongly our processes are running. Now, frankly, to me, accuracy, or so-called focus on quality, is less about the process and tools, which is very important, but it is about a mindset. And quality has to be a KPI of the front-end phlebotomist of a lab and for the CEO. That's how you get to know. Where we are also focusing on is what is called the pre-analytical phase, because a large part of errors can be linked to that, which is basically from the time the sample is picked up from the patient till it enters analyzers. So that's what accuracy is all about. Efficiency is when we deliver the result, how efficiently we make sure it reaches our prescribing doctors. And that's where, again, integration and technology comes in. As soon as the lab doctor presses a button, automatically the lab results are available on a monitor for the prescribing physicians. And we spoke a little bit about how it can reach to the patients as well. So that's what we do to ensure accuracy and efficiency of lab diagnostics.
So it's key to ensuring samples are treated with care and processed to the highest standards. Unfortunately, we have run out of time. Thank you so much for sharing with us the challenges and the opportunities in early detection, diagnosis, and prevention. Appreciate your time today. Thank you.
Thank you.